Hello, I'm Dr. Wise with Wise Regenerative Wellness. Thank you for watching to learn more about regenerative stem cell therapy. I'm going to spend a few minutes sharing with you this great type of treatment and will do my best to answer as many of your questions through this presentation. I would like to introduce some of my colleagues and staff as well, so let's get started. I am fortunate to be partnered with a team of world-class medical professionals and scientists, as you can see here with their credentials under their name. I'm sure you're here to find out how this revolutionary therapy came about and how it can help you, because you or so many know is suffering from something that has changed their quality of life, like chronic pain or injury. What if it was possible to harness the power of the body to heal and accelerate it in a clinically relevant way? What if we could help the body heal better? Did you know your body has been producing stem cells daily since you were born? As you get older, your body degenerates. It breaks down and you deteriorate physically and mentally. The opposite of degeneration is regeneration. The field of regenerative medicine is working to restore structure and function of damaged tissues and organs. The goal is to find a more effective way to restore and rebuild damaged tissues, bone, cartilage, as well as treat chronic disease. What made your body can heal your body. One of the most difficult aspects of regenerative medicine for people is navigating the landscape of sources for treatment. What products are derived from and what do products contain? The good news is research and treatments are showing much promise for regenerative medicine, which you will see later in this presentation. The next question we get most frequently is, what are stem cells and how do they work? So it's very important we start with a good medical foundation and science-based definition, since there's so much out there on this topic, and it can become very confusing. How many have Googled stem cells? It's pretty confusing, right? Let's start with a pure science perspective. Stem cells are undifferentiated, which simply means that they're capable of reproducing cells of a similar type or of a different type. Stem cells are a master cell that seek out degeneration to help rebuild and grow new tissue, bone, cartilage, and repair muscle. They improve immune system functions and reduce scarring. I will share two types of cell treatments and compare the differences for you. We will start with autologous cells. These cells are derived from your own body and they are either extracted from fat or bone marrow. This requires a surgical procedure which is invasive, expensive, and can have potential complications. Can be painful and can include recovery time with possible physical therapy. Using older cells from your own body can reduce the effectiveness, which we will touch on a little later. We use human umbilical cord blood, which is derived from healthy, screened, tested, and consenting C-sections. They are collected by an FDA-certified blood bank and sent to our lab for processing and additional testing prior to treatment. There is no potential for adverse or allergic reactions, and they're completely undifferentiated cells. These cells innately know where to go and what to do. The cells are immune system privileged, which means anyone can be treated. They target inflammation, which means they are highly anti-inflammatory and have optimal ability to stimulate growth, repair, and regeneration for healing in tissue, bone, and cartilage. They can be administered multiple times in uniform dosages if needed, but most find relief with a single treatment depending on each individual's diagnosis. This non-invasive treatment is an in-office procedure and can have little to no downtime. Mesenchymal stem cells can self-replicate, differentiate into different tissue types, reduce inflammation, and have high live cell counts that are much more potent than autologous stem cells from bone marrow or fat. Our product for treatment includes mesenchymal stem cells, cytokinase, which signal, growth factors, which repair, hyaluronic acid, proteins, and electrolytes. The combination of all this is what sets us apart from other options. This graph shows that cells become much less potent and effective based on your age. As we get older, we don't produce as many stem cells, and the ones we have are aging. So we aren't able to regenerate tissue like when we were younger. As it shows here on the graph, a newborn has about 1 stem cell in every 10,000 cells. At age 50, it's 1 in every 400,000 cells. You recover and or heal much slower than someone younger. So you can clearly see human umbilical cord blood stem cells are more effective for treatment than autologous cells. Human umbilical cord blood is obtained from FDA-certified regulated AATB blood bank agencies who collect from pre-screened C-sections and run a series of tests for safety. Blood and tissue products for treatment are pre-screened by an FDA-certified accredited tissue recovery bank. The ATTB runs a series of tests for safety, which include the following: HIV, hepatitis, West Nile virus, human T-cell lymphotropic virus antibody, syphilis, Epstein-Barr virus, Chagas disease, and cytomegalovirus. Our product contains a high-level mesenchymal stem cells, cytokinase, growth factors, hyaluronic acid, proteins, and electrolytes. The process. Stem cell therapy is a non-invasive injection of mesenchymal stem cells, growth factors, and cytokinase into your joints and or body that potentially repair, restore, replace, and regenerate cells and show promise in treating many medical conditions and diseases. Some advantages: have high anti-inflammatory activity and ability to stimulate regeneration, more potent than bone marrow and fat, anyone can be treated, immune system privileged, administered multiple times if needed, cord blood is bank tested and ready for treatment. Here are degenerative conditions we treat currently: chronic joint pain, arthritis, osteoarthritis, tendonitis, the knee, shoulder, elbow, hands, feet, hip, and or injury. Here's a list of more studies underway. We want you to get good information to the right information. It is important to note that there are over 5,000 studies all around the world being conducted and over 500 active clinical trials in the US being conducted, which include double-blinded and placebo-controlled studies. Many studies are for osteoarthritis of the knees, shoulders, hips, low back, and neck. You can check these studies out at these sites for more details. Here are some frequently asked questions. Is regenerative stem cell therapy safe? Yes. How many treatments will I need? Most experience great results with one, and others may need more depending on their circumstances. What is the downtime? Most patients experience no downtime. Like all healing, you should follow medical advice on restrictions and rest by the type of treatment administered. How quickly should I expect results? Some experience about 10 to 20% change in the first 24 hours. Most show promise within about 4 to 5 weeks. What does it cost to have treatment? We will address this in your individual consultation and exam, since each treatment type is a bit different. Let's do some cost comparison. So let's look at the cost. A knee surgery on average costs $33,000. And this does not include post-op downtime of 4 to 6 weeks, possible physical therapy, and additional follow-up doctor visits. If you add this in, one can expect a bill to be close to $40,000. With a copay deductible, the out-of-pocket may be well over $10,000. This doesn't even include loss or reduced income from time off work. All right, here are some of our testimonials or patient stories, which you can pause and read on your own time. All right, I'd like to say thank you for watching this. I hope I am able to answer as many of your questions as possible. If you have any other questions, feel free to give us a call at 303-216-0105. We can schedule you for a free consultation. Also, feel free to visit our website at wiseregenerativelewellness.com. Thank you.